The American Heart Association seeks to be a relentless force for longer, healthier lives. Here in Illinois, the association is expanding its fundraising and prevention efforts. In addition to its ongoing work in Champaign and Peoria, the association has a new focus on Bloomington-Normal. The previous Peoria Heart Ball has been renamed and reimagined as the Central Illinois Heart Ball. It takes place October 2nd at the Paradise Casino in East Peoria. Vice President of Operations at OSF St. Joseph Medical Center, Dr. Colleen Blackburn, is the leader of the new Central Illinois Heart Ball. In this interview with WCBU correspondent Jamie Hand, Blackburn says the mission remains the same, but the association hopes to reach more people.
Well, I think one of the big changes we've made as I came in for the Central Illinois chapter of the American Heart Association is really looking at focus across Central Illinois. Historically, the efforts have been in Champaign and Peoria, and we've really broadened that into the Bloomington and McLean area because we know that there's heart health and heart health issues across multiple counties in Central Illinois. And we want to make sure that all those counties are really being able to have the support and education for longer, healthier lives.
And so this year, the former Peoria Heart Ball is becoming the Central Illinois Heart Ball, which takes place on October 2nd at the Paradise Hotel and Casino. Why the change?
Historically, being from Peoria and working at OSF in Peoria and then moving and transitioning into OSF Bloomington, I think I really saw the need to expand and have the opportunity to do that with the American Heart Association and the Heart Ball. Heart disease affects everyone across the nation, across the world. And we're doing efforts here in Bloomington especially, and I wanted to really recognize those. We've done education programs within local high schools here in Bloomington, as well as across McLean County.
How does your team hope to impact the future of Central Illinois by fundraising for the American Heart Association?
I think one of our major efforts with the fundraising is to get more education into our schools, especially high schools and grammar schools. We want to really start young and provide that CPR as kind of the entryway into heart health. And that can really lead into those other discussions about healthy eating and family history and exercise and really just maintaining that heart health for a lifetime.
And what's the benefit of starting young with the kiddos on the education?
Well, I think what we've really seen is, heart disease, it's not just an old person's disease. There's more and more young people, unfortunately, with heart attacks or with high blood pressure or high cholesterol. And I think it's getting that education early on to make those decisions earlier as a child and really those eating habits, those exercise habits, and establishing that healthy relationship with food or with exercise so that you're preventing anything in the future.
I'm Jamie Hand here with Colleen Blackburn talking about the Central Illinois Heart Ball. What can guests of the Heart Ball fundraiser expect on the evening of October 2nd?
Well, hopefully it'll be a great time and a good party. But it's really about, again, we recognize survivors from different heart disease. We usually try and have a survivor at different milestones, so child, middle age, and adulthood.
What made you get into this line of work?
Well, my whole family on my father's side has heart disease. And I think that's how I really got connected into some of the cardiovascular work that I've done, as well as I think into the American Heart Association. That's always my why behind it. My father's family is historically really healthy. They eat really well. I still have aunts and uncles that run marathons well into their 60s and 70s. But I've had multiple heart disease and heart attack. And it's really back to our genetics and our family history and high cholesterol. Not something we necessarily can control even with great diet and exercise. It's about that early prevention, getting in to see physicians, yearly checkups, controlling blood pressure and cholesterol right away, even if that requires medication. That's my why behind it.
As you've gone through your career and you've been doing this type of work with the Heart Association, what have you seen change in our community?
I think there is more awareness of heart disease, and I think overall we are inching our way to a healthier community. That makes me really excited. I think when we looked at especially obesity, which plays a major part in the heart health as well, even 15, 20 years ago, it's still an epidemic. It's still one of the major contributing factors. But I think we're starting to slowly see some of these proactive education, healthy diet, healthy exercise starting to take root within not just Central Illinois, but our entire nation.
We all know someone who's struggled with heart disease. What other implications are there for the Bloomington-Normal community other than the loss of a family member or a friend when it comes to heart disease?
I think something people probably don't immediately go to is the economical factors of heart disease. It puts a large strain on hospitals and those resources there. It can lead to crippling, medical debt if a family member is faced with that from a loved one or from another family member. And so sometimes it's that ripple effect of the economic kind of downfall of heart disease.
What other kinds of things does the American Heart Association do that can help people in Bloomington-Normal?
One thing, we don't see every day, as just daily citizens is really the research efforts that go in from the American Heart Association. Money that is raised goes back and helps fund national projects that includes, McLean County and Central Illinois to better research not just current medication and clinical trials for cardiovascular disease, as well as future trials.
And can you tell me just a little bit about what you recommend the average citizen around here in Bloomington-Normal do to take charge of their heart health?
I think the best thing you can do is really get in for that annual exam with your provider. That really allows you to establish your baseline, get your cholesterol, your blood pressure, any other comorbidities that you may have. And from there, you really know your numbers and can track those moving forward. If your blood pressure is increasing or your cholesterol, you have an established relationship with a provider, readily available to pop back in if medication is needed or additional information. You already have that relationship. So really establishing that first and foremost, even in your early 20s before you get into cardiovascular or other health disease is probably the most important thing you can do.
That's Dr. Colleen Blackburn from the American Heart Association speaking with WCBU's Jamie Hand. The Heart Association's work finds that every 34 seconds on average, someone in the United States dies of cardiovascular disease. As our population ages, the cost to our community could increase. As they mentioned, early detection and prevention is key, and even young people should consider asking their doctors to help them understand their heart health. You can find more information about the inaugural Central Illinois Heart Ball at wcbu.org.